Today's date is February 18th, 2015. We're here with Timmy, that's how she goes, and she came to us from Hawaii. And she just landed a couple hours ago and ran up here with her husband from the airport. Timmy has had about 4 years of intractable low back pain. Is that correct? And you
Maybe more.
Maybe more. And you have seen everybody, as you put it. You've even had a spinal fusion at L4, L5. It's fused with bars in place. You have seen chiropractors. You have seen acupuncturists. You have seen physical therapists. I think you told me you've seen at least 40 specialists. Is that correct?
Pretty much.
And no one's been able to help this pain, correct?
Yeah.
But the specialist who's over here helps you, correct, by massaging you at night, correct? It helps you to some degree.
Yeah.
Good.
No, but I do go to masseur.
Good.
Yeah.
Okay. And you came because you heard that I do ozone therapy, and you came 2,800 miles from Hawaii.
Yeah, pretty
right?
much, yes.
That's a long trip.
Yeah.
So when I first examined you, you had almost no straight leg raising. You couldn't get your leg up like this, right?
Yeah.
And I checked you for root canals. You have one. It checked negative. You have implants, and they could potentially be a problem. But I'm mainly concentrating on your back, where we know you have some significant degeneration. And we just did ozone injections on your back. All right?
Yep.
Let's just check something here. Let's get this straight out. What is your comment about getting your leg out now compared to when you walked in the door?
Much better.
Much better.
Yes.
All right.
In fact, let me try do it myself. Yes.
Are you surprised?
Yes.
All right.
I couldn't do it before.
No.
I mean, straight.
No, you couldn't do it
Yeah.
before. All right. Let me see you get off of that chair and walk to the door, please, and tell me how you feel.
A lot better.
A lot better, you said.
Yeah.
Is there any pain left?
Little bit.
Little
Yeah,
bit. Okay.
little.
So where, can you show me where the pain is? Turn around and touch your back and show me where the pain is.
Oh, it's gone.
What? Turn around. Say that again.
It's gone.
Okay. Pain's gone. Let me see you bend over now and touch your toes.
I could
She
go
has
a
never
little bit
been able.
further.
She has, in her life, she has never been able to
Yeah.
touch her toes.
Well, she couldn't touch her toes then, but how does that compare to before we did it?
A lot better.
She can
Yeah, a
really-
lot. Look.
She
See?
can, she
That's what you did before.
Yeah.
You couldn't even get
Yeah.
that low before.
Well, yeah. And now,
Yeah.
I'm very impressed. Sir, what do you think of what you just saw? Was it better?
What I think you're not a doctor. I think you're a magician.
You're very kind. Now, I intend to post this on YouTube. Is that okay with you? Thank you. Is that
Okay.
okay with you too?
Yeah.
All right, let's just check something else too. Can you raise your leg for me now? And let's see, as high as you can get it. Okay, and the other side? All right. What are your thoughts on what you can do now compared to before?
oh, way better.
Okay. I don't expect to get 100% movement out of you. You know,
Okay.
you've been stiff and
Yeah,
sore and everything
for a long
time.
Yeah.
There's fixations, but the fact that your pain, you said, is now 100% gone, and your muscle strength is much better. I just checked your ability to separate your legs, right? That's
Yeah.
called the hip abductors, to abduct moving, meaning moving your leg out in this direction. And you had no strength in that muscle before, and now it's very strong, is it not?
Yeah.
Okay, let me show you what I did. For you and the viewer, what I want to point out is that I made an injection into this joint right
Yeah.
in here,
Uh-huh.
and on the other side as well. It turns out that many medical doctors, in fact most orthopedic doctors, miss the fact that the sacroiliac joint can cause
Yeah.
a significant amount of dysfunction going down the leg, all the way down even to the foot. And I think that made a huge difference in you. I also did this joint right here, L4-5.
Okay.
And walk to the door and back, please. Okay, come on back and sit down.
I feel stiffness. That's what it is.
Stiff, that's fine.
Stiff it. Yeah.
There's a fair amount
Yeah.
of gas that's in there.
Yeah.
So you feel stiffness, but the pain is basically gone.
Most of it, I would say.
Okay. If the pain stayed like this, could you live with it?
Pretty much, I think.
You'd be okay.
Yeah.
All right, good. Now you asked, sir, you asked how long might this stay away? In truth, I don't know. Here's why. The local anesthetic wears off, and it wears off in, it's a very short-acting local anesthetic. It wears off in 15 minutes.
Okay.
In many cases, many, in fact, the majority of cases, the pain does not come back in 15 minutes. The local anesthetic, the fact that you're relatively pain-free now tells me that I got the right spot. That's my job. My job is to localize where to put it. Now, what happens after that is up to your body. I don't know what your body's going to do. There's ozone in there that we put in too, which reduces inflammation and promotes healing. And in many, many cases, the pain doesn't come back, or it comes back much. If the pain starts up here, it comes back much slower. And then we might need a few more tries at it until we get maximum results. In some cases, we get 100% results. In some cases, we don't. I'm always happy if you get 60, 70, 80%. That's good.
Okay.
But in backs, typically, we see about 80% overall results. So I can't tell you how many treatments you're going to need based on what just happened. If your pain doesn't come back for days, really, really good sign. Then it might come back some and we could do this again.
Okay.
Or maybe we could find somebody in Hawaii to do it, but you flew 2,800 miles to come see me. So that tells me there must not be very many people in Hawaii who can do this.
Have there ever been any?
Zero. He says.
I'm the first one?
No, he said there's zero. He just gave me a sign saying
No
there's zero people in Hawaii who can do this.
Oh yeah, yeah. But I'm just saying, have you treated people from Hawaii before?
Oh, yes.
Oh, you did?
Oh,
Okay.
yes. Yeah, you're not the first.
Oh, okay.
But it is a long trip for that.
Yeah.
Okay.
So what do? They don't.
Well, I don't know that there's anybody in Hawaii who does exactly this. So they usually stick around here for a week or two and give me every opportunity I can to work with them, and hopefully when they go back, there's very little discomfort. This is the type of treatment that requires an injection. Many people come here from Hawaii with discomfort or problems, not discomfort, with energy problems,
Yeah.
Lyme disease, infection, and we can help them at a distance. This requires hands-on injection techniques. Understand everything?
Yeah.
Very good. Thank you. We just completed a PEMF treatment on you, pulsating electromagnetic fields. The local anesthetic would have long worn off by now. It's only like 5 to 10 minute treatment, and you're well over 30 minutes now. How do you feel?
Much better.
You're happy?
Yeah.
Okay. Let me see you bend over and touch your toes, please. I've got to tell you, I'm impressed, okay?